Keynote speaker Dr. James Stockson explains why thoracic outlet syndrome must be examined and treated as a spring and not a lever in his #1 international best-selling book.
Biomechanics, and we talk about the body as a lever system. And currently, the medical profession and a lot of sports trainers and athletes understand the body as a lever mechanism. There's a training method which uses the levers. That's called resistance training. And then there's another training method that uses the springs, the spring mechanism. And that's called plyometrics. So this method of training used a different biomechanical model and mechanism to build the body spring system. For your information, why this is important is that the thoracic outlet is a tunnel that allows the safe passage of blood vessels and nerves, and it's designed as a spring system. The shoulder is suspended by a suspension spring muscle called the trapezius muscle, like a roof, over the rib cage, which is the floor, by a spring suspension system. When athletes hit in football, they hit their shoulder with the pads on, of course, but of course they have their own spring mechanism in the shoulder that protects them from injuries to the nerves and the blood vessels that are in the tunnel underneath the shoulder.